Hi, I'm Prerna Reddy and I'm the director of the Talk Learn Rehabilitation Center, Hyderabad. So I'm going to talk about what are the commonly seen feeding difficulties in children on the autism spectrum disorder. The number one difficulty which is commonly seen is accepting only few textures. Either they like to eat very crunchy food or they like to eat everything really soft. They are very preferring in the texture that they like and they are not ready to explore anything beyond it. The second thing is selecting textures based on their smell and their taste. They are very specific. They smell their food before they eat. They are very specific even in the taste that they like. Often parents come and tell us he likes everything a little bit spicy, they like it whenever it is, and often refuses to eat fruits because the fruits have a specific odor that they release, so they don't like the smell of the fruit, often reject the smell and often don't eat the particular food. So this is one more difficulty that is seen. The third difficulty that we see is with temperature. They either like everything too hot, they like to eat it very hot. We may feel that the tea is burning hot, but they would still drink it. And we would be surprised, oh, he drank the tea even if it's so hot. Even with food, either some of them really like food which is very hot in temperature and often sometimes like even very cold temperature and not even go near something that is hot. The fourth difficulty that we see is having often very limited variety of food that they eat. Parents often tell us he just drinks milk, has some murku and have very limited, either eats one charu and annam or eats one or two kura. So it's a very limited variety that the child is eating. And this is an often common complaint with almost 90% of the children that we see, that they are having very limited variety of food that they even explore. They may eat one or two fruit, one or two snacks, one or two breakfast items and eat one or two standard dinner items. And the food is often made according to their preference. The fourth thing is being very particular about the brand of the food that they're eating or even the shape of the food. Suppose they're eating a French fry and the French fry is looking slightly different, they get really upset and they don't like. And this being a specific color, shape and smell. So even that they are very obsessive. They only like it a particular shape or a size and even if you change that, they are very irritated and often rejecting the food that they see. So these are the common things that we see in children on the autism spectrum disorder who are having feeding difficulties. If your child has such feeding difficulties, your child should see a speech therapist who specifically specializes in feeding therapy, which can be us. Please consult us. Thank you.